All right. Hi, everyone. Welcome to our 2021 QCDR Kickoff webinar. Thanks for joining us today. My name is Karen Campos, and I'm joined by Zach Smith, and we will be leading this presentation today. Just some housekeeping reminders. This meeting is being recorded, and we will send you all the link probably within a week or so, as well as a copy of the presentation slides. And if you have any questions during the presentation, please just enter them in the Q&A box, and we'll go ahead and answer them throughout the presentation as well as at the end. And we can unmute anyone who wants to answer or ask a verbal question as well. All right, so today we're going to cover the 2020 Mips final scores, review the 2021 extreme and uncontrollable circumstances, as well as the new QPP updates for this program year. We'll go over how to submit your data, how to prepare for our audit, some DIR things such as secondary capture, top-down measures for this year, the new submission method for grid, and lastly, do some Q&A. So for 2020, CMS applied an automatic exemption because of COVID. So if you did not submit any data for 2020, you won't be negatively impacted. But if you did submit at least 2 performance categories, you will receive a performance score. And these final scores will be posted on the CMS QPP website sometime this month. It's hard to believe that we're already in July. So for 2021, CMS will continue to use the extreme and uncontrollable circumstances policy to allow reweighting of 1 or more Mips performance categories to 0 because of COVID, but it won't be automatic. You have to submit an application. So I've linked the application here. And if you would like to receive credit for the COVID-19 clinical reporting improvement activity, you can submit that this year as well. And if you would like any information on the impact of COVID on your participation, I've linked the QPP COVID-19 response page and how to do the application guide at the bottom. So for this year, the category weights are very similar to 2020, but they have shifted slightly. Quality has decreased from 45% to 40% of your total Mips score. And cost has increased from 15% to 20% of your Mips score. Improvement activities and promoting operability are the same weights as last year, 15% and 25%. All right, to meet your category requirements for the quality performance category, they are similar to last year. You have to report at least 6 Mips quality measures, including at least 1 outcome measure or a high priority measure if you do not have an outcome measure. Or you can do 1 defined specialty measure set. You would have to report all the measures in that set. Or you could register for the CMS web interface and report on all 10 CMS web interface measures. I will say that this interface is going to sunset in 2022. So this is the last year that you could use that submission if you are interested in doing that. You'd have to submit 1 full year of data for all of these different methods from January 1st to December 31st. And the data completeness this year is 70%. So you have to submit at least 70% of your data and also 20 cases per measure. At least 20 cases per measure. You can still get bonus points for submitting additional outcome or high priority measures or by using electronic health record technology to collect your data to get end-to-end reporting. And small practices will continue to get 3 points if they don't meet data completeness requirements. And at the bottom here, you can see there's a 2021 quality quick guide, start guide, and how to explore your measures and activities. So the benchmarks here, I wanted to show you all what, these are all the measures that we can collect through our QCDR, and I've shifted them out based on which ones have benchmarks and are not topped out, which do not have historical benchmarks, which are topped out, and which ones are topped out and have a 7-point cap, just as like an easy guide. CMS is using 2019 historical benchmarks to score quality measures for this year, and they will continue to do same year benchmarks if a quality measure does not have any data. And these benchmarks are based on what CMS has posted early June. I also wanted to list out all of the data submission mechanisms here as well, and there are links for all of the 2021 quality measures. If you're listening to this webinar, you're most likely submitting through us, which would be at the very bottom of the direct. So just something for you all to have as a reference. So facility-based scoring is similar to last year as well, just another way to participate in the program based on the hospital value-based purchasing program by your facility. Individual Mips eligible clinicians qualify for this facility-based measurement if you've billed at least 75% of your covered professional services in a hospital setting, billed at least one service in an inpatient hospital or emergency room between that October 1st and September 30th period, and then can be assigned to a hospital VPB program score. Groups can qualify for this measurement if at least 75% of the clinicians in the practice qualify for this facility-based measurement. And the facility-based scoring quick start guide is linked at the bottom. All right, moving on to the cost category. As a reminder, this category is automatically calculated by CMS using Medicare claims data. There are no historical benchmarks for these measures yet, so I'm not sure how CMS is grading them. And we have 20 cost measures in the program this year. 18 are episode-based measures, and then one is the total per capita cost measure, and the other is the Medicare spending per beneficiary clinician measure. And those are linked at the bottom. And again, CMS will calculate costs for you, so we won't know how much of that, what your score will be for that until you get your final score, if you can even attribute any cases to your TIN. So for improvement activities, the requirements are the same too. You report 4 medium weighted activities or 2 high weighted activities for a continuous 90-day period to receive full credit. Non-patient facing rural and small practice physicians can report 2 medium weighted activities or 1 high weighted activity. And for group reporting, at least 50% of the group must attest to the activity. So you all have to be doing the same activity to get credit. I've also listed the promoting interoperability requirements here, although most of you are probably exempt from this category as non-patient facing clinicians. But again, you just have to use the 2015 edition certified electronic health record technology, and you have to do this required measure set for a continuous 90-day period. You have to attest to the prevention of information blocking, the ONC direct review, and also that complete the security risk analysis measure. And then there are 5 to 6 additional measures that you'd have to do in this measure set to receive credit, as well as provide your EHR ID number. So for the low volume threshold this year, if you fall below this threshold, you do not have to participate in Mips. You'd have to bill more than $90,000 in Medicare Part B covered professional services, see more than 200 Medicare Part B patients, and provide more than 200 covered professional services to Medicare Part B patients to be above the low volume threshold. If you are under all of these, but you'd like to still participate in Mips, you can either opt in or voluntarily report. By opting in, you would submit data, receive performance feedback, and receive a Mips payment adjustment in 2013, and you cannot reverse this decision. Or if you'd like to voluntarily report and just see what kind of score you might get if in the future you would have to participate in this program, or for whatever other reason, you can submit data voluntarily and receive performance feedback. And we can do both of these methods in the QCDR this year. Last year we were unable to do voluntary reporting, but this year we did allow that function. So I've added in here just some of the reweighting scenarios for you all, just so you can see what your category weights are. If you're promoting interoperability weight gets moved over to quality, and same with cost. So I will let you all review this for a second, but for the most part, most of the category weights get moved over to quality if you are exempt from one or the other. And then some key dates and timelines for you all. January 1st is when the performance period began this year. In May, CMS opened the hardship exemption for promoting interoperability and the extreme and uncontrollable circumstances exception application. October 1st is typically the deadline that we like to give you all to start submitting data to the QCDR, just in case you're having any problems or need assistance. It gives you a good cushion to get help and get your data corrected if you need it. October 3rd is the last day of the final continuous 90-day performance period for the improvement activities and promoting interoperability categories. So you'd have to start doing your activity before October 3rd to get credit for that full 90-day period. In last day of December, the 2021 Mips performance period ends. And then you have until the end of January to submit data for the 2021 performance period to the QCDR. In February, you would review all your data and begin selecting the measures that you want to submit to CMS. March 31st, 2022 is the deadline to submit your data to CMS. And then in the summer, you would receive your performance feedback. All right, and with that, I will go ahead and turn it over to Zach.
Thank you. Let me just get my screen pulled up here. Okay, so I'm going to start off just giving a quick overview of how to submit data. Most of you are probably familiar with this process, but I just want to walk through it again and remind everybody that the portal is open for data submission. So, you know, if you've been waiting to submit data, you can start anytime. We open it up at the beginning of every year, so you can start submitting data in January, but sometimes it takes a month or two for us to actually get the benchmarks in there and actually start calculating the data that you're submitting. But just letting anybody know, if you haven't started submitting data yet, you can start now. So as always, to submit the data, first you're going to want to open up the NRDR webpage and go to the Mips participation portal. That's also where you can view your performance scores, and then when the time comes, submit your data to CMS as well. Now, when you click on the Mips participation portal, it'll bring up this landing page, and you'll just want to click on data collection and reports to get to the section where you actually submit your data and view your reports. And this is what the upload data tab looks like. This is where you'll go to upload your Excel or your text templates that you've populated with your Mips data. Now, later in this presentation, I'm going to talk about the Grid 2.0 measures, which we're going to, in the near future, be implementing a way to submit through this same portal. So just keep that in mind. We'll have more information about that soon. But for now, this is where you can go to upload your Mips data. And as many of you are aware, there can be errors that happen with the Mips files that you submit. It's really important to take a look at the Excel file specifications or text specifications, depending on how you're submitting. We update these every year just in case there's any changes with the template files that we're using. Now, some common errors that you might run into when you're uploading files is there could be an invalid file name. Maybe you don't have the date or the time entered correctly, it's missing the correct number of characters, something like that. It could be that physicians are not listed in your account, or they're not enrolled in Mips. This is something that you can fix in the NRDR side of the portal. That's nrdr.acr.org. It could be an invalid TIN as well. Some people have noticed, if they accidentally add a space after a 10 or something like that, it can invalidate your submission. And then there could also just be missing data fields. So, denominator information that's supposed to be there, or, incorrect numerator codes, something like that. Those can all cause some errors when you're uploading your files. So the main thing to look out for is if you see any files that are rejected, or if they say successful with warning, what that means is you're going to want to check your log file, and that'll tell you exactly what the issue is with what you've submitted. And this next slide is going to show you what that looks like when you scroll down on the upload files page. So what you'll see here is a list of all the files that a site has uploaded. You can see in the second column what date the file was received, then what date it was actually loaded into our system. And then the status column is really the important one. If it says successful, then you'll know that it's pretty much all good. If it says successful with warning, it could mean that there are a few files or a few records in that file that you want to take a look at, and maybe make some corrections to the data you've submitted. Typically, that means you've submitted an invalid numerator code, or you've submitted something just missing a numerator code. So what successful with warning means is that the record was added to the denominator for that measure, because we know it's part of what belongs in that patient population, but it wasn't, it didn't include enough information for us to score it performance met or performance not met. And you can see a breakdown in the last few columns of the number of records in the file. If there were records rejected, how many were there? If there were records added, and then if there were records updated. Updated just means that you've uploaded a duplicate of a file that you've already uploaded. So, in this top line, they uploaded 1,077 records. 222 were rejected, but 839 were successfully added. And that leaves 11 records that were just updated. So that probably means this site had 11 records in that file that they had submitted in a previous file. And then added with warning, this site has 5. And that probably means that 5 records they submitted just were missing a numerator code. And if you go all the way to the far right of the page here, you'll see the action column. You just click that button there, and that's where you can download your log file. So if you see anything that was rejected or added with warning, that log file is where you can go to see exactly what the problem was with that row in your spreadsheet. It's really handy, and anytime people come to us with questions about why a file wasn't loaded fully, we just look at that log file, and that can usually tell us what the problem is. And I'm not going to go into great detail on the performance report, but it is available now, and it's updating with data that you've submitted. So this is where you can see all of your Mips measures and all of your QCDR measures that you've submitted thus far in 2021. You can see the score breakdown at the group level, and then also at the individual physician level. And you can compare your scores against historical CMS benchmarks if those measures have benchmarks. Usually for measures that don't have benchmarks, we calculate a registry benchmark to give you kind of a general idea of where we think you're going to fall. But most of these measures have historical benchmarks at this point, so you can see exactly how you're going to score if you continue submitting with roughly the same performance level. And this does update within about 24 hours. So after you've submitted data, whether it's Mips measures or QCDR measures, this performance report is going to update, so it's updated way more frequently than the quarterly reports that you get for, say, GRID or the dose index registry. So I would recommend checking this all the time. As soon as a file is accepted, give it about a day, and then you should see those scores update in your performance report. And I know nobody thinks this is a pleasant subject, but we have to talk a little bit about audit preparation. As we do every year, we have to audit some TINs and NPIs that are using the QCDR. This is a CMS requirement. And it's been going pretty smoothly for the last couple of years. I think some of you probably went through it one of these last few years. But basically, it's going to be similar to last year for quality measures. You're going to have to submit patient reports for a selection of cases that you submitted. And then for improvement activities, you'll have to submit validation documentation. Now, one thing that's new is that we also have to audit promoting interoperability measures. Now, fortunately, most people, as Karen said earlier, are not going to be required to submit promoting interoperability. But if any of our audited facilities are submitting PI, they can expect to have those PI measures audited. Now, for the quality measures, we're basically verifying the denominator information, which is like patient age and sex and the exam type, and also exam date, just making sure it matches what was in the template that you uploaded. And then we look at what you gave for the numerator response, and we look at whether that matches what's on the report that you sent us. So if we're auditing, say, measure 145, which is the fluoroscopy measure, saying that you've given the number of images and exam time, we would be looking to make sure that you indeed included all that required information on the report. CMS does have this handy guide that they, to my knowledge, haven't really released in this format for previous years. But if you click this link after we send the PDF to everybody, it's the validation criteria for the improvement activities and the PI measures. And it's really handy. It'll tell you exactly what type of documentation is recommended to submit in case you're audited for IA or for PI. We'll begin reaching out to facilities around August, and we'll continue that through the rest of the year. So if we contact you at any point through the year, just be aware that we're auditing quality and improvement activities and PI. So, if you're submitting your quality measures now, we'll start auditing those. If you haven't chosen your IAs yet, then we'll audit those when it gets closer to, submission time, when you actually submit them. But to help us out, if you want to choose your IAs early so we can go ahead and knock out that part of the audit, that'd be great. It seemed to be pretty easy last year. Everybody that we audited for IAs submitted documentation that was totally fine. Especially if you look at that data validation criteria, I think it'll give you a good idea of what you need to submit for that. And this sort of dovetails with other audit issues. This is something that we brought up last year as a problem that we had identified in previous audits. And we wanted to give everybody an update on what we're doing for people that are submitting DIR data for ACRAD 34 using secondary capture. So if you're submitting ACRAD 34, that's the CT dose measure for head, chest, and abdomen studies. We recommend taking a look at your CT standardized dose index report. That's one of the interactive reports that you can get to from your NRDR homepage. Now, everybody who's submitting data for DIR is either submitting each case through the dose reports, the RDSR, or they're submitting through secondary capture, which is basically like a screen grab that the software pulls data from to determine what the numbers are for that case. Now, there's a problem with secondary capture, which is that it doesn't consistently capture all the characters in the dose report, and therefore it can incorrectly either lower or raise your DLP numbers, which obviously will skew your performance on that measure. So what we've decided to do for 2021 is that if we find that a facility who's submitting for Mips and they're submitting ACRAD 34, if they've submitted greater than 20% of their DIR data for those exams that are relevant to ACRAD 34, if they've submitted more than 20% through secondary capture, they may be subject to additional auditing. We'll take a look and just see if the data appears to be irregular. And I've got some screenshots in the next few slides that'll give you an idea what I'm talking about. But that may mean that you're going to be subject to additional audit on top of what we're already auditing. And so to completely avoid this issue in the future, for 2022 and beyond, we're just going to subtract those secondary capture cases from the numerator of ACRAD 34. So what that'll do, if you have too many cases that are being submitted through secondary capture, it will negatively affect your data completeness for that measure. Now, if it's just 10 or 20% that you're submitting, then that wouldn't affect your ability to actually submit that measure and get full credit for it. But as you know, the data completeness has to be at least 70% for a measure. So if it falls below 70%, that measure will be subject to lower scoring, which typically is either 1 or 0 points. So just something to be aware of. And I'm going to walk you through how you can check this for yourself. So to actually get to the interactive DIR reports, you'll want to start out on the NRDR page. And then under the quality improvement registries, click on DIR. And then from that DIR directory, you'll click on CT Standardized Dose Index. This is the interactive report where you can look at all the data that you've been submitting, and you can narrow it down by exam, by scanner, all that stuff. So the first thing you can check is you can just get this simple pie chart that shows you how much of your data is being submitted via secondary capture. So what you would do is click on the exam search tab, choose your corporate account and the facility or facilities you want to look at. You would set the date, obviously, from January 1st of this year through the present day. And then you can set the RPID or the study names for the 3 different exams that are used for ACRAD 34. And those are listed here. And what you'll see when you choose that exam, if you see in the screenshot here, I've chosen CT chest without contrast. You can see that 90.9% of their exams thus far have been submitted using RDSR and 9.1% through secondary capture. Now, this means that if we were to just take those secondary capture exams out of their numerator, they would still meet data completeness most likely. It depends on what the other 2 exams look like, but as long as they're not getting below 70% data completeness, then they would be okay. But I'll give you an idea of what the problem is here, and you can check this for yourself if you switch over to the scatter plot over time view. So what you see here, all of these different symbols, the circles, crosses, asterisks, and X's, are all different CT scanners. And then each individual symbol represents a different exam. Blue being exams that come from RDSR, and red are exams that come from secondary capture. You can also mouse over any of these symbols just to see more information about them. You can see what scanner it came from, what the DLP score was, and all that. But if you see here, all of these red X's, almost all of them are at the very bottom of the scatter plot. And what that shows is that something is not being captured correctly from those secondary capture exams. This is skewing the data downward and affecting the accuracy of the data overall. So if you think this issue might be affecting you and you think it's skewing your performance and potentially could be enough to trigger an audit, look into whether you can change the way you're submitting. I understand that most CT scanners now are capable of submitting via RDSR. So some people might just not know that they're still submitting secondary capture for some of their scanners. So look into this and check your numbers. And then if you have questions about it, if you need assistance from our DIR team, just open a ticket with us through the NRDR support email. So moving on, I also want to talk about the topped out and the removed measures a little bit. This is definitely relevant to a lot of the QCDR users that we have. 2 measures were removed for 2021. One of them that I've highlighted, we had a lot of people submitting this measure. 437, not so much. That probably won't affect as many people. But 146 is the inappropriate use of probably benign in mammography measure. Now, this means that there are very, very few mammo measures left, unfortunately. And in addition to these measures being removed, there are several measures that are also considered topped out and are going to be capped at 7 points for 2020. Of these measures, I think the ones that are most popular would probably be 145, 195, 360, 406, and 436. We have a lot of people submit those measures. And so to offset this, we definitely recommend submitting as many extra measures as you can, because any measures you submit beyond the 6 that are required can potentially give you some bonus points and hopefully help you offset that, that reduction of your score with the 7-point cap. Now, also be aware that some of these topped out measures may be removed in future years, but I will say that we're looking into ways that we can update some of the measures that we steward. And if we can make changes to some of these measures, then it can hopefully help improve the longevity of some of these measures in the Mips program. What CMS really wants to see is that we can take measures that are topped out and change them enough that they're capturing data slightly differently and maybe not looking so topped out anymore. So we can't really make any promises on that, but it's definitely something we're looking into because we want to maintain as many of these measures as we can. Now, on the bright side, I want to remind everybody about the Grid 2.0 measures. We added these last year, and we had quite a few people start submitting a handful of these around the end of the performance year. And hopefully we can get even more submitting them this year. But these measures were added to the grid registry and are also available for the QCDR. So you can get credit for Mips for these measures. I'd say the ones that have been most popular so far would be 36 and 40. That's ACRAD 36 is incidental coronary artery calcification for chest CT. ACRAD 40 is use of structured reporting in prostate MRI. But all of these measures are available through the grid registry. And we encourage anybody who's participating in grid to look into submitting them. Now, that being said, we also are trying to develop a new submission method for these measures that will make it even easier to report them. Right now, you have to submit them through the grid template and upload them through your grid registry page. But what we're planning for, hopefully within the next month or so, is to create a simplified template that allows you to submit these measures using the Mips portal. And the format is going to be very similar to the Mips template, which is, basically you give the denominator codes, you give the numerator codes, and then the rest is just kind of the basic exam information. So I'm going to switch over to give you a live demo of kind of what we're working on. It's not a final version of this Grid 2.0 template, but it should give you a pretty good idea of what you're going to be filling out to submit these measures. So give me one moment and let me just switch my share over to this Excel file. Okay, I'm going to zoom in so hopefully everybody can see this. But what this is a template file that's essentially just based off the Mips data template. I've listed all the Grid 2.0 measures here. So you see 36 through 42. This is just for, for your information. This is the measure number and the description. But the actual data that's going to be populated in this template, you can see is almost identical to what's used for Mips measures. We've got exam date and time, physician 10, physician NPI, the patient ID, the acceptable age range for the measure, the gender, and then you give the measure number, denominator CPT code, And here's where it gets just a little bit different. In the Mips file, this next column would be the diagnosis code column, which is basically, if you're submitting a measure for, say, an incidental renal mass or something like that, some of those Mips measures will give you a diagnosis code, which would indicate, presence of an incidental finding. And so in order to meet the denominator for that measure, you would give us both the CPT code, which, say you're doing a chest CT, it might be one of these codes. And then you would give an additional code letting us know that something on that report helped fulfill the denominator for that measure. Now, each of these Grid 2.0 measures has a different description for like what the secondary denominator information that's required is going to be. But what we're trying to do is just distill everything that's required for that denominator into one code that you can give just to indicate that, for example, ACRAD 36, you're indicating that the body area of this exam is non-cardiac. Now that's because this is a measure for incidental coronary artery calcification. So obviously it wouldn't be incidental if it was a cardiac exam. It's only incidental if it's an exam that's not specifically looking for, issues in the heart. So moving on, we've just got the numerator response code, which is very similar to Mips in that there's a code for performance met and a code for performance not met. So for example, you might say 36X00 or 36X01. And that tells us if you met performance on this case or you did not meet performance. And then to wrap it up, you just give the exam unique ID that you use in your system for that measure. So if we want to look at ACRAD 40, since that's another one of the popular Grid 2.0 measures, this is percentage of final reports undergoing prostate MRI for prostate cancer screening that include a reference to a scoring system such as PIRADS. So for this measure, you've got 10 NPI, age, sex, and then measure number, ACRAD 40. We've got these two codes which indicate that that this is an MRI, but there's not a specific CPT code that indicates prostate MRI. So this code is going to indicate that the body area of this exam was prostate. I believe it's also going to indicate that this was a surveillance or screening exam. And then, the numerator, that part's simple. It's did you meet performance by including a reference to a scoring system, or did you not meet performance and there was no reference to a scoring system? So what we're going to do once we have all of these elements finalized is we're going to send this file out to everybody that's participating in Mips, and you can start working on pulling this data from your EHR. I think that the only section of this that will require a bit of work from anybody that wants to submit is figuring out a way to code these secondary denominator info codes into your reports so that you can have a way to easily pull this data out if you're pulling a large amount of data and putting it into the template file. But essentially, this works exactly the same way that a Mips measure does. It's just that the additional denominator information is a little bit different. It's not a diagnosis code. It's more a code that gives additional information about what the exam was, what the purpose of the exam was, things like that. So hopefully everybody is excited about this new template. I know we had lots of requests from people to make these measures a little simpler to submit. Now we will still allow you to submit data through Grid for these measures. So if you're already submitting this data through the Grid registry using the Grid template, you can keep doing that. That's totally fine. But if there are people that would rather submit this way, then this will be an option very soon. And it will be available for the 2021 performance year. So go ahead and start taking a look at these Grid measures if you want to. You can look at the list on the acr.org/QCDR site. just go to the QCDR measures supported for 2021, and you can see the descriptions of these. You can see the measure specifications for them, and you can go ahead and start thinking about whether you might want to submit them and how you can actually pull that data if you do start submitting. So again, we're just working on finalizing these CPT codes, which will hopefully be done within the next week. So we'll be getting this information out to everybody very soon. But I did just want to show everyone while I've got you here on this webinar, because we're excited to hopefully make this easier on everybody. So with that, I think I'll go back to the PowerPoint, and we have a little bit of time for questions. So first of all, the contact information for us is here. You can submit a ticket through the NRDR support site or email us at nrdrsupport@acr.org. Or you can just call us at our line, extension 3535. And as always, we've got our information on the QCDR page at acr.org/QCDR. So if we've got any questions in the question box, we can go ahead and read those out and answer them.
Thanks, Zach. Yes, we do have one question right now in the Q&A that we haven't answered yet. From Susil Shah, who says, the current grid 2.0 2.1 template has 83 fields, whereas the one that you just showed, Zach, is only showing 11 fields. Are we going to publish this new template soon? And if so, when? And I think you just said we were trying to get it out within a month or so.
Yes, and
Yeah.
actually, Stacy, we just got a question from Stacy who's asking something about this as well. So yeah. To clarify, we are going to try to have the template out to everybody within, ideally a week or two. I think we're going to get the final list of CPT codes for all the denominators on Friday this week. That's tomorrow. So, hopefully we'll have this finalized. We'll get it out to everybody. We're also going to make individual measure specification documents that kind of mimic the formatting of Mips measure specifications. So it'll give you a good breakdown of, the denominator elements and the numerator responses. Now, Stacy asks, for these new codes, will you have to go back to the beginning of the year to add these codes? It depends on how you want to work that out with your, EHR system. You will be able to submit that data retroactively. It's just a matter of, if you can figure out a way to pull that data that was, that was submitted over the last few months. If you're able to code that and pull it for this measure template, then that'll absolutely work. It might be something you need to talk to your IT people about, something like that, just to figure out how to pull all that information. But yeah, I think our idea is that anybody who wants to submit these will be able to pull the data retrospectively and submit it.
Zach, can I add to that?
Yes, please.
Hi, this is Judy. And going back to Sushil's question also, the new template is part of will be part of the Mips template for Mips measures file submission. Would be separate from the grid template, so we won't be updating the grid version. We're going to maintain the grid version and then add the grid 2.0 measures to the Mips template. And to go to Stacy's question, to some extent, if you've already submitted data using the grid file specs and uploaded it to grid, as Zach said, you can maintain that process and continue to do that measure by measure. But if you want to switch to the Mips style template, you should do that for all the records for a measure. So we can't really mix what you've submitted in the grid template to what you may submit in the Mips template. So it has to kind of be all or nothing per measure. If you've already started submitting data for a couple of measures using grid, and it's easier for you to go down, continue down that path, then you can do that. And if you want to add new measures but use the Mips template, then you should put all your data in for those measures in the Mips template, so that it's not mixing it. We'll have in the Mips portal performance page, will indicate whether one of the Grid 2.0 measures has been submitted through Grid or through Mips. If you submit the data through the Mips template, then your performance report will be what's in the Mips performance portal and the Mips interactive reports. That's true for Grid, for submitting through Grid also. But if you are submitting through Grid, you will additionally get the data, performance data in your Grid PDF reports and the Grid interactive reports. And those reports are facility-based, whereas the Mips report, the Mips performance portal report is, I'm sorry, I just got a delivery, where the Mips performance portal reports are 10 based versus facility based in the Grid reports. That may have been too much detail, but I just wanted to kind of clarify the process and the workflow for how we're looking at those two methods of submitting data.
Thanks, Judy.
Thanks, Judy.
And
Yeah.
we'll put that all together in a documentation in a packet. We'll do a webinar. One of our upcoming webinars, we'll talk more about it too and go into more detail and show you the
For sure.
Yeah.
And we do have a couple more questions related to that template, so I'll answer those. First, I'll answer Sushal's question. He was saying that usually the grid measures have time and date fields included, but he didn't see those data elements in the sample template. We do have exam date and time on that template field. Now, this does not have like the turnaround time data elements on it because we're not changing anything about the way we submit the turnaround time measures. So those are going to continue to use the old grid template. This is just for ACRAD 36 through 42. So there is exam date and time, but there's not, report time, what time it was signed and all that. Now, James asks, will you share the workflow for filling out the new template? Yeah, I'll try to explain a little bit better, especially if you're new to Mips and aren't super familiar about how to use this. With the Mips template, you basically just have a blank Excel document where the columns have, headers for all the data elements. So like exam date and time, patient age, CPT code, all that stuff. So this Grid 2.0 measure template is going to be basically exactly the same as that. Every row of the spreadsheet is going to be populated with a patient case. So every row will be a different exam for a different patient, on relevant to whatever measure you're planning to submit. So it wouldn't look exactly like that file that I shared because that's really just kind of a summary of all the acceptable data elements for each measure. But the actual template that you upload is going to just be a big Excel file, potentially with maybe thousands of rows that are just going to represent each patient that would be relevant to that measure. And it's the same way that it works for the Mips measures. You just populate that full template with all of the cases that you want to submit, and then you upload that file to the Mips portal. So whether it's the Mips measures or these Grid 2.0 measures using the new template, it's all going to go through the Mips portal. Maribel is asking if these grid measures are considered high priority, similar to ACRAD 15 through 25. I think they are, but let me check really quick. I'm just going to pull up the specification document really quick. Yes, they are all considered high priority, which I'm glad that you asked that, because that means, even though these measures are not going to have a historical CMS benchmark, first of all, the more people who submit them, the more likely it is that they'll get a same year benchmark and that they will be eligible for 10 points. Obviously, they'll default to 3 points while you're submitting them, but the score can potentially go a little higher. But because they're high priority, that means that if you submit them in addition to your current 6 measures, then they will be eligible for bonus points. And yeah, you just typed that. That's exactly right. So yeah, if you have 6 measures and then you submit any of these grid measures, they can all give you bonus points. Okay, we'll give a little more time for some more questions. Got about 9 minutes left. I'm glad people are interested in this new template for grid. We're really hoping it can drive more people to submit these measures, and hopefully keep these measures in the program a little longer.
I do want to read out one of the previous questions that we received during the presentation, which was, are records with warning excluded from all reporting? In other words, are they excluded from the denominator population until a proper numerator is provided? And I just want to say if the numerator is missing or is wrong, then the record will be counted towards your population for the reporting rate, but it won't be counted towards your performance rate.
Yeah, and what that means is that it will affect your data completeness. So say you've got 10,000 exams for a measure and 1,000 of them didn't include a numerator. That would mean that would be 10% of your data completeness would be not scoreable. So you would only have 90% data completeness for that measure. If you submitted 9,000 with a numerator and then 1,000 without, it would hurt the data completeness. Now, obviously, if it's only a handful of cases and it doesn't make your data completeness dip below 70, then it's not going to hurt your ability to get a good score on that measure. But if you have a lot of cases that are successful with warning, then you do want to make sure you correct them, because it does mean something's missing there, and it'll hurt your overall data completeness. It's similar to what we were talking about with ACRAD 34 and the secondary capture issue. If it's just a handful of exams coming through as secondary capture, then it's not really going to hurt anything. But if it starts to become a large portion of what you're submitting, then it can start to hurt your data completeness and potentially cause you to not get a full score for that measure. And yeah, Karen, thank you for clarifying to Mirabelle. I saw Mirabelle lost audio when we were talking about the bonus points. But yes, those ACRAD measures are all high priority and will give you bonus points. We'll give it maybe another minute for questions. And if we don't get any, we'll just wrap up a couple minutes early. And we will send a recording of the presentation out along with a PDF of the slides. So any of the links on here, if you want to take a closer look at any of the stuff, you can click those links, and we'll get that to you within the next day or two. And yeah, Mirabelle, that is correct. Even if you don't perform well on those extra measures that you submit, so say you submit 6 measures that are all performing pretty well, and then you submit a bunch of extra measures that you're doing badly on, if those measures are high priority, they will still give you the bonus point. And CMS will pick the highest 6 measures. So there's really no downside in submitting additional measures.
You did get one more question in the Q&A. Someone says we've been reporting unfavorable responses for numerators that we could not complete. So it seems better to leave those as missing the numerator versus sending unfavorable, correct?
No, definitely. If it's performance not met, then please give us the performance not met code. I mean, CMS is pretty harsh about any attempt to kind of like cherry pick the data that you're submitting. They, you know, if they find that anybody is submitting cases with you know, only their performance met and then leaving out the performance not met, they wouldn't look kindly on that.
And that if that was audited, if your group happened to be selected randomly for an audit, that would potentially be uncovered, and then we would have to do a detailed audit, and there would be a plan for a correction, and so it would go down that pathway too.
And they did just clarify for unknown responses, they've been sending the performance not met. So, I mean, I guess it depends what you mean by unknown. You know, for some measures, it's pretty cut and dry, you know, whether you did or did not meet performance, because some measures are asking, you know, was this present in the report? And you can see pretty easily if whatever the language that's required to be in the report is there, then it's performance met. And if it's not there, then it's performance not met. So, I mean, it might be, if you want to maybe send us an email and give us some more information about, you know, what you would consider an unknown response, we could maybe look into that a little closer. I know that there probably are some cases where you know an exam should go into the denominator, but you're not sure how to code it. So yeah, I'll just say I'm not sure. Sushil says current grid specs do not include performance rate or data completeness formula. So I'm hoping the formula is the same as other Mips measures. And yeah, that it is the same. All of these grid 2.0 measures are proportion measures. So it's just numerator divided by denominator. Now the turnaround time measures are different. They're scored in a different way, but yeah, for all of the grid 2.0, it's simply how many performance met divided by what's the overall patient population. And data completeness it's really going to work the same way as all the other measures do, which is when you go to submit the measure on the CMS submission page, you either attest that you've submitted 100% of measures, or you give us the actual number. So if you've only submitted, you know, if you know that there are several thousand exams you didn't submit, you would give us the actual number of exams you performed, and then we calculate the data completeness based on how many you did submit. Okay, and it's about the top of the hour, so I think we can go ahead and wrap up. Just want to thank everybody for joining today, and big thanks to Karen and Judy for helping out with the presentation too. So again, be looking out for more information from us about the Grid 2.0 stuff, and we will get you these slides and the recording very soon. Hope everybody has a nice holiday weekend. Thanks.
Thanks, everyone.